I love acute medicine because every day is different, and the variety and the intensity in the type of work I do makes it a really exciting job. Acute medicine really came from the idea that we needed a coordinated approach to assessing and managing acute medical patients when they come into hospital. Before acute medicine units, we had patients being admitted all over the hospital under various specialties. The idea of having acute medical units is we can coordinate all those resources in one place. It's a real multidisciplinary way of assessing and initiating treatment for these patients, reducing the amount of time they need to be in hospital and actually getting them home again. An acute physician is a consultant who is responsible primarily for the acute medical unit and the way that the acute medicine service is delivered and operates. So they are a senior clinical decision maker, they are there to support the medical and nursing staff on their ward and their training. They are there to help develop the service in terms of acute care pathways, and they are there as the interface between the rest of the hospital and the acute medical unit. I have a 5-week rolling rota where I do a different role every week. So I do a week of take where I am on call and I'm seeing patients as they arrive and assessing them and managing the acute medical team who are on call with me. And then I have a week where I'm in an ambulatory care clinic where I'm seeing patients straight from the community, or I'm seeing my patients who have been discharged from the unit and need to come back to see me again in an outpatient setting. And then I also do a week of what we call our level 1 area, which is where our sicker patients are. It's where we provide our monitoring, slightly increased nursing levels, and we can provide a little bit of ventilatory support as well. But really that's the sicker end of the medical patient who doesn't quite need critical care within an intensive care unit. And then I have a week where actually I get a chance to catch up on my non-clinical commitments. So my kind of SPA and research activity. So that can be from teaching or attending courses for my own professional development. And it's my chance to look at how the unit is performing, what ideas and things do we need to put in place. It's my kind of service development time, if you like, my chance to step back from the clinical side and look at the service as a whole. In my 5th week, we've built in a prospective cover week with our rota, because the nature of working in an acute medical specialty is you can't just cancel the acute medical unit to go on holiday, so you have to build in that type of thing. So that adds to it being sustainable, and that's the key thing really for trainees to understand, is that we're not on call all the time. I do on call, of course I do, but I mix that with the clinical and non-clinical commitments that I also have. And if I am on call or work a weekend and an evening, that's compensated in the rest of the work I do, so I may have a day off during the week, the next week for example. I see the majority of patients from start right through their admission to discharge, and that adds to the satisfaction of the job too. An elderly lady came in a few months ago with very nasty septic shock. She was extremely unwell, and we admitted her to our level 1 area, and that's where we could provide support for her chest with our chest physios. We could provide our physiotherapist input. She had occupational therapy input there. She had pharmacy input because she was on a lot of medications that were interfering with the drugs that we wanted to give her. And it's also given us the opportunity to spend a lot of time with her family as well. She was in one clinical area with the same team looking after her, and we built up a really nice rapport with that family. She did get better, and we got her home, which was fantastic, which was a real multidisciplinary effort. She had a lot of needs, both physical and social needs. And that's really satisfying. It shows our ability to use the whole team, to use our investigation as well as our treatment pathways effectively. If somebody needs that increased support from us, we're able to offer it, and that's really satisfying. I would recommend a career in acute internal medicine to trainees who really enjoy working on an acute medical unit, who thrive in that multidisciplinary environment, who love the breadth of clinical presentation that comes through the door to acute medical units, who've got good common sense, who show initiative and drive and a real enthusiasm to change our system to improve the care that we provide our patients. To become an acute physician, there are 2 alternative routes into the higher specialty training programmes. After foundation training, a doctor can go through core medical training or the acute care common STEM training programme to enter acute medicine. Higher specialty training in acute internal medicine is a 4-year training programme, but we encourage trainees to also dual accredit in GIM, General Internal Medicine, and that's another year's worth of specialty training. During those specialty years, they will be gaining experience and skill in a variety of different medical specialties as well as acute internal medicine on acute medical units, and that's so that they can go into their consultant jobs with that breadth of knowledge and skill. They are also required to develop a special interest as well during their specialty years. For some trainees, that is a skill-based interest, and that might be echo, ultrasound, scoping. It may be an academic interest where they undertake a serious bit of research during their training years, or it could be developing an interest in another medical field such as stroke, intensive care medicine, toxicology. People told me this was a really risky career choice 10 years ago. And when I look back at it now, I can say, no, it wasn't. It's been the best decision I made because I get that clinical variety I was looking for. It's a sustainable career. It's a flexible career. And I still get to enjoy all, not just the clinical aspects of my job, but I've really got stuck into the other non-clinical aspects of service development and just the development of the specialty. It makes me very proud to be an acute physician.